right?
Mm,
The most recent quiz that you just uploaded?
Yes.
Yeah. All right. So we can begin? Okay, so now I have to...
We are live. Just give me a second, okay?
Okay, let me get myself set up with the screen sharing.
So your topic, yoga for stress and anxiety relief?
No, somebody, mine is on sleep disorders and management.
So this topic was for whom? Yoga for stress and anxiety.
Somebody, I think you have the updated schedule. You may not have the updated schedule. This one we took out, the yoga for stress and anxiety.
Okay.
Somebody, I'll send you the updated one again.
Okay. Because you said that the updated one is on the classroom. But
yes, on the classroom. Is it the old one still?
But it is not in the classroom.
So I have to sort out why it's not updating, because it's shared.
Maybe you have uploaded. So yeah. So yeah, final YYT that was you from your side.
I'm sharing it. Like the one that I keep updating is shared with the classroom, I thought, but I think now it's not coming up in the classroom. So I have to recheck why it's not sharing. I've got direct sharing of my updated schedule to go straight to the classroom, so people can see if I make any changes right away in the classroom. But maybe Cyril, at the end, you can help me to connect that, because I think it's not updating. If somebody's you're still seeing
sure,
yoga,
no problem.
stress, and
Will do.
anxiety, then that's old. That was changed a long time ago, somebody. So I'll have to put the updated one up there. So we cut some of those talks out, and we're beginning the medical sessions. And yesterday was the sleep and sleep disorders. And today I'm talking about the medical management of sleep disorders. Can everybody see my screen?
Yes.
Yes.
Okay.
Yes.
So shall I begin? Somniji?
Yes. You can.
Okay. Okay. Good evening, everyone. Welcome back again for our evening sessions on our medical topics. Yesterday, I spoke about sleep and sleep disorders. And today, I'm going to be talking about the medical management of them. And then tomorrow, Somniji will be talking about the pranayam and mudras and meditation for sleep disorders. And then on Friday, Rameshji will go through some of the yogasanas, which are helpful in sleep disorders. And that's how most of our medical sessions are going to be running. So I hope, it was just yesterday, so you all will remember what the sleep disorders were. But if you have any questions as I run through the medical management, then please feel free to interrupt and ask me. So when we come to medical management of sleep disorders, before we talk about medicines, we're going to be talking about sleep hygiene. And that's true for adults and children alike. Before you think about giving any medications for sleep, you first want to make sure that they all are doing good sleep hygiene. And what does sleep hygiene involve? So sleep hygiene involves several things. First of which is having a good routine for bedtime, having a good scheduled time to go to sleep and to wake up, and then also to have a good environment in which to sleep. So obviously you want an environment with reduced noise, you want to have the light turned off, you don't want to have a lot of stimulation going around, and you also want to make sure that the temperature of the room is not too hot or too cold, because all those things are going to affect how you're able to fall asleep. And all of these things, obviously, you might just do naturally, but when somebody's having a sleep disorder, it's even more important to focus on them. The second thing is diet and use of substances. So obviously, you don't want to be doing caffeine or drinking coffee at night just before bed. and also not taking any nicotine at least 6 hours before bedtime. You want to limit the use of alcohol, and also eating a balanced diet. And one of the other things that's really important is you want to eat early in the evening and not eat too late, so that your stomach has enough time to digest the food and that you're in a good state to go to sleep. Third thing is what you do during the daytime. You obviously, if you're having problems sleeping at night, as I had said before yesterday, that it may be because you haven't been active enough during the daytime. So you want to make sure that you're going to do some exercise during the day. And also you're going to make sure that you're out in the daylight, so that you're staying awake and you're not just inside indoors in the dark and falling asleep in the daytime. And then when you get into bed, you want to restrict activities in bed that are going to keep you awake. So you don't want to be on your phone, you don't want to be on your computer in bed. All those screen times are going to keep your brain active. You really want to do activities that are going to induce sleep. So you really want to have the lights turned off and be in the dark, and then you're going to be falling asleep much more easily. And then obviously habits, making things a habit and being educated in how you can sleep better. You go to bed when you're tired. If you go to bed too early and you're not tired at all and you're just lying in bed, they say that you shouldn't stay in bed for longer than 15 minutes awake. You should get up and then go, if you're unable to sleep, go up and do something and then come back and go to sleep again. But I always question that, because I think that if you get up and you reactivate your brain, especially if you start watching TV or you go on your phone, then you aren't going to be able to go to sleep again when you go back after 15 minutes. So it's more about being up, but not doing activity. And somebody will talk about things tomorrow. And Ramesh, hello?
Hello, Naina Ben. Yeah, about this getting out of bed if unable to sleep within 15 minutes.
Yes.
It does work sometimes when you get up and get a glass of water,
right,
for example, and then another 5 minutes, and then you go back. It does help.
It does help. Good. Thank you, Ramesh. Right. I'm glad, because I mean, I haven't had any issues myself, so I don't know what it's like. But I was just thinking that if you get out of bed and you start doing an activity, it might delay it. But that's good to know. And it's not good to do too much exercise or vigorous exercise just before going to bed either. And then you're going to educate yourself about normal sleep and sleep behavior. So that's all just a general way and general knowledge about how you can help yourself fall asleep without doing any medication management. Now I'm going to talk about each of the conditions I spoke about yesterday. And for the specific conditions, what we do in the cases when sometimes this general sleep hygiene is not working. So the first one, and the most important, is the primary insomnia, the one that I told you that a third of you people suffer from that. So even in our group of people listening here, 3 of us are going to be having problems with sleep. The pharmacological treatments for this can be prescription drugs or over-the-counter medications. A lot of the time it's like the antihistamines that can make you feel drowsy. And then the prescription drugs are sleep medicines. Most commonly, they're the benzodiazepines, which are like the nitrosopam. And that's actually can be a problem, because the side effects of the prescription drugs, which are controlled drugs, are a lot. They can cause excessive sleepiness in the daytime. They can cause dependence on those, and they can cause rebound insomnia, which means when you're coming off of them or stopping them, you're going to be unable to sleep again. Other medications like Remeron is actually it also works on the brain. It's like mirtazapine. It's an antipsychotic, and that actually helps with falling asleep, but also that will have its own side effects, just as trazodone, which is an anxiolytic, has its own side effects. So most of the prescription drugs are going to come with side effects. So you really only want to be using them if it's really necessary. We always also, at the same time as giving any medication, are always going to say to get some behavioral therapy. And cognitive behavioral therapy is the best therapy for primary insomnia. And that's where you go to see a psychologist or a counselor who's going to then train your brain to help with sleep. They'll do some relaxation training. They'll start talking about setting regular bedtime routines, sleep restriction, like not having too much sleep for longer periods of time. If you're not able to sleep early, like if you're not sleeping at the right time in the night time and you're sleeping later and then waking up later, then they're going to restrict you waking up later, so bringing that earlier and things like that. And then also confronting any unrealistic expectations about sleep. Like if you're really thinking I have to have like 10 hours of sleep and you really only need 7. So all those things, if you have somebody who's knowledgeable and telling you, then that can be very helpful for sleep. All right. So if there's any questions for primary insomnia? Okay, we move on to sleep apnea. So sleep apnea, if you remember from yesterday, is obstructive sleep apnea or central sleep apnea. And the obstructive sleep apnea is much easier to treat because it's usually because you have an obstruction to your airways most often. And simple things like weight loss will help that, especially in an obese person. Then there's this thing called CPAP. It's continuous positive airways pressure, which is actually a machine that you have on the side, and then it has these connectors which go into your nostrils, and they provide you a continuous positive pressure with air, a flow of air that goes into your nose, and you have to wear it the whole night. And it helps to keep a person's throat open. And the airways open, so then they're not having that obstruction. There are sometimes medications which we use actually for central sleep apnea to stimulate breathing, so they work on the central nervous system. And one of them is medroxyprogesterone and sometimes tricyclic antidepressants, and they're working more on the central sleep apnea. The other one that actually, sorry, I should have said this earlier, is for the obstructive sleep apnea, there can be mechanical devices that can reposition the tongue and the jaw, because sometimes people have a difficult time. Remember I told you that their tongue can be falling back on itself, or the palate's closing the airway. Then this can bring the jaw forward so we can open up the airway at the back. And then finally, you have to have, if none of these things are working for obstructive sleep apnea, you have to have surgical correction, which is exactly what I'm here in St. Louis for. As I told you yesterday, my son just had that done. It's removing the tonsils and adenoids. It's not a very pleasant procedure as an adult, so hopefully nobody needs to get that done. But that's what they have to do. They have to remove the obstruction in the airway to help the person to sleep and breathe better in their sleep, I should say. So any questions on sleep apnea? All right. Next, we move on to circadian rhythm disorders. And as just a reminder, those are the ones that occur when you have shifts in your work schedule, like you're doing night shift and then you're going to day shift and you're changing back and forth. And it's also when you are traveling across the time zones, so that you are having a hard time sleeping when you're going forwards or backwards in time. So the treatments for those are basically you're doing phase delays or phase advances. So you're slowly moving your bedtime later and later, or moving it earlier and earlier, depending on which direction you want to go. If you're not being able to sleep because the timing is not right, then you're going to start moving it later. And if you're actually earlier, sorry. So if you're not able to sleep at night because it's still 6 o'clock from where you were and now it's 9 o'clock here, then you're slowly going to move to 7 o'clock and then 8 o'clock and then eventually get to 9 o'clock. And the opposite going in the other direction. And one really important thing I forgot to mention, I'm sorry, earlier on in medications for over-the-counter, there's something called melatonin. Many of you may have heard of that name. It's actually the natural hormone that your own body produces from the pineal gland, and it's the hormone that helps you to sleep. So on a regular daily basis, when the sun goes down and it becomes dark, the melatonin secretion starts to happen, and it induces sleep, and then it helps you to fall asleep. Sometimes people have less secretion of the melatonin, and particularly in children who have some conditions, sometimes developmental disorders or ADHD, they're often not secreting enough melatonin. And then a common treatment that we give is melatonin. And even in adults, especially some of the people who have the circadian rhythm disorder, they will take melatonin to help them induce sleep at that time. And that's actually does also work. And it's a over-the-counter medication, and it has very few side effects. So it's quite commonly recommended to use before you start using any prescription medication drugs. So I remember that because it can be used in circadian rhythm sleep disorders as well as a medication. And the other thing is use of bright light. And that when we're talking about bright light, it's actually very, very, very bright light, almost like phototherapy kind of bright light. And I've got this in greater than 2,500 lux. And I had to look this up myself because I wasn't sure what that actually meant. But that's actually how bright the light is. And just to tell you that 1 lux is 1 lumen of light over 1 square meter. And if you have an overcast day, it's 1,000 to 2,500 lux. Full daylight is 10,000 to 25,000 luxes, and direct sunlight can go up to 100,000 lux. So they recommend in circadian rhythm disorders, you're going to use 10,000 to 25,000 lux. So that's almost like a full daylight in the day. And what the purpose of that is that if you're doing that, then you're actually suppressing the melatonin. So by having this bright daylight, say at nighttime when you're trying to, having the bright light helps the melatonin to suppress and helps you to stay awake. So if you're falling asleep too early, then you use this bright light and it helps you to stay awake. And if you're getting up in the early hours of the night, in the early hours of the morning, then if you use the bright light, it will suppress the melatonin there. So it's the timing of it is very important. So you want to use it to suppress the melatonin so you stay awake. So if you're falling asleep too early, then you're going to have that bright light at that time. And it's 10,000 luxes or more that you want to use. And you get, like, I think it just comes as these bright light, tube light kind of things that you keep in your room. And then obviously we're going to talk about relaxation techniques more when we hear from Samniji, because that probably is going to be the best therapy. Then cognitive behavioral therapy, which I spoke to you before, and medication. And the most common medication here that we prescribe is melatonin, because that is what we want to do to help you fall asleep if you're having a hard time falling asleep. So that's a little bit confusing because I know that the bright light's actually suppressing the melatonin. So it's actually using the melatonin at the time when you're falling asleep and using the bright light if you're falling asleep at the times when you should be awake. Any questions? All right.
Hi, Naina. What happens like if you keep the light on and you get faster sleep?
What happens if you keep the light on and you fall asleep?
Yeah.
So if you fall asleep with the light, the light in the room is less than 2,500. So it's not a bright light that's suppressing the melatonin. It's not affecting the melatonin in the brain, the light in the room. So if you're falling asleep with the light on, then that's fine. I mean, there's not a problem with falling asleep, but it probably will disrupt you if you remember I told you about those sleep cycles that you go through.
Yeah.
And so when you come to the awake time of that cycle, like you go through stage 1, stage 2, stage 3, stage 4, and then you come back to awake. At that time, if your light is on, then it might make you awake. And so then you'll have interrupted sleep at night, because every time you cycle through, it'll be that time and the light is on, and then you might be completely, totally awake. And then it's a hard time again to go back to sleep again. So that might be a problem there, but it doesn't change the melatonin in your brain.
Okay. Thank you.
All right. Restless leg syndrome. So if you recall, restless leg syndrome is when you're getting into bed. It happens mostly in the evenings at night, and it's a sensation that you get in your legs where you have to feel like your legs want to keep moving, like you can't settle down to sleep because the funny sensation in the legs. And if you haven't had it ever happen to you, it's very hard to understand what that feels like. But sometimes it happens a lot in people, and it really does affect them in falling asleep. So what we recommend in those cases is that they have to do regular exercise, such as walking or stretching, and that should be in the daytime. More physical activity during the daytime, and then as they come to going into bed, they should do good stretches. And then that often helps not to have that funny sensation that you feel in the legs. Reducing the amount of caffeine and alcohol and limiting its intake definitely helps to improve sleep for those people. And in cases where those things aren't working and the regular sleep things aren't working, then using medications can be necessary. And in this case, they use dopaminergic drugs like levodopa or gabapentin, but then also clonazepam and clonidine. They're all other medications that help with the dopamine levels in your brain, and then that will indirectly help you to sleep. Narcolepsy, that was when you have an excessive daytime sleepiness. So it's really important to have good sleep hygiene. And it's really important that you stay awake to help you to stay awake during the daytime. They often need medication. This is one condition where just doing good sleep hygiene is not going to work just by itself. It's usually has to be done in combination with medication, because it's a condition which is occurring without really it's not that you haven't had enough sleep at night and that's why you're falling asleep in the daytime. It's actually the reverse. You're actually falling asleep because of this condition that how your brain is, and it induces a sleep, and then you're not able to sleep at night. So you actually need stimulants to help you to stay awake during the daytime. One of the common ones is Provigil or modafinil. And then when you have those stimulants to stay awake in the daytime, then you're going to do the good sleep hygiene so that you have a good sleep at night. So both of those have to go in combination. It's not one or the other to help with the narcolepsy. Then we'll move to sleepwalking and sleep talking. And this is much more common in children, as I told you before, but there are sometimes adults who will complain about this. And to help with that, it's really just to have a good regular sleep schedule. And then making sure that if they are doing sleep talking is not such a bad thing. It really just awakens everybody else that's there in the house, but sleep walking can be hazardous to the person that begins to do the sleepwalking. And it's really making sure that the environment is safe. And like we've sometimes had the parents who complain that the children actually opened the front door and walked out of the house. So that's actually super dangerous, obviously, in the middle of the night. So you're going to make sure that all the locks and things are on in the door. And as I said, sometimes they have complex things that they start doing in their sleep. So you want to make sure everything is safe around the house or in the bedroom if somebody is commonly sleepwalking. And then sleep talking, and this is this word I hadn't even heard of before, somniloquy. It's a nice Scrabble word, which means sleep talking. And apparently if you reduce liquids near bedtime, helps not talking in your sleep, practice relaxation techniques before sleep, and avoid large meals late in the day, which is what we always recommend. Also helps with anybody who's having a lot of sleep talking. And sometimes adults also do have a problem with having really sleep talking at night. So some of those things would help in those cases. Okay, moving on to nightmares. Nightmares is happening in the stage 4 of the REM sleep. So it's when you've gone through all your stages, so you go to the last stage, that's when you're having these vivid nightmares. And the treatment for and these are ones that you recall during the day. So one of the things that you want to do, especially if it's children, and it's happening more in children than in adults, is removal of cause. And most often children are getting nightmares when they've been watching any scary movies before they go to bed. So obviously you're going to tell the parents, remove the scary movies, because they will then, even if it's not so scary, in fact, we just recommend that you don't watch any movie 2 hours before bedtime, to take that whole thing out of the picture. But because sometimes, even if it's not a scary movie, when the child goes to sleep, your brain has such a big imagination that they start imagining a lot of things that then turn into scary things, and then they wake up with nightmares. Doing exercise earlier on in the day, in the daytime, being more active than being passive helps to avoid the nightmares. And then in adults, limiting the intake of alcohol and caffeine. And once again, relaxation techniques are always coming in here and are always recommended to be very helpful with any sleep disorders, as Somniji will tell you tomorrow. Sleep terrors was happening in the stage 3 of the non-REM sleep. And it's when the child is waking up and screaming, and they don't recall that at all when the episode has happened, and they're very difficult to console. It usually happens at the same time, because you remember I told you go through the sleep cycle. So always in that cycle, when they get to stage 3, that's the time when they're having the sleep terrors. So one of the best managements for that is to time when they're happening, and then we tell the parents, and even if it's an adult, you're going to wake that person up just before that timing. So let's say like 10 minutes or 15 minutes before the timing when the sleep terrors happen, you go and shake them and wake them up, and they have to be totally awake. And you just say, oh just, hello, or go back to sleep again, kind of thing. You're waking them up, and then you want them to go back to sleep again. So you don't want them to be wide awake and they want to start playing, but then you don't want them to not be awake enough that they've acknowledged that they're awake, because then if you do that awake, they go back again into the stage 1 and it starts again. So often, if you've broken that cycle of sleep terror, sometimes it doesn't happen again. They don't have it happen around the clock. Like, if you're going to 4 or 5 sleep cycles, it doesn't seem to happen 4 or 5 times at night. It's usually that one time, and then they break it, and then they seem to be sleeping okay. But sometimes you might have to schedule that awakening if it's happening more frequently. And in very extreme cases, we've had to use medication. I've never had to use medication when I've had children coming in with sleep terrors. Usually the improved sleep environment and scheduled awakenings works really well. But in those cases where it is extreme and it's not helping, then we might have to use an antidepressant or benzodiazepine. You really want to try and not avoid any of those kinds of medications. And I think that was the end. I think that was all of them. So if you have any questions, please feel free to ask. I'll stop my screen sharing so I can see everyone. That's going to take me a minute. Okay, let's see. All right. Good. Does anybody have any questions?
Naina, I have a quick question.
Yes,
if
she
you,
does.
how do we know that we need melatonin? Like, is there a test, or do we, if you're just not falling, like if you wake up in the middle of the night and then can't fall back asleep, is that like a?
Okay, that's a good question, Sheetal, because we don't ever measure melatonin levels, so we don't know what your level of melatonin is, and to see, oh, is it low that you should take melatonin. But if you're having a hard time falling asleep, then it's a good time to take melatonin if other things have not helped. When you wake up in the middle of the night and you're not being able to go to sleep again easily, it's very you have to take melatonin with caution, because if you take it too late at night, where it's going to be more towards the morning time, then you might not wake up in the morning on time, or you'll be drowsy when you wake up in the morning, because it's really works for that period of time, like 6 to 8 hours, say, that it's going to be hard for you to then wake up in the morning. So you don't want to be giving it, say, at 2 a.m. or 3 a.m. If you're having these early morning wakenings, you're not going to be giving melatonin or using melatonin at that time. But say you go to bed at 10 or 9 or 10 and you wake up at midnight, then you could take melatonin, and always start with a low dose and then you increase. And I mean, the doses of melatonin can be less than 1 milligram and up to 10 milligrams. That's the max. And I usually recommend, like, it says an adult, I probably recommend starting at 1 milligram up to 3 milligrams. Then you will slowly increase. In kids, we can start at even lower at 0.25 milligrams or 0.5 milligrams, and then we increase. But I haven't had anybody who's come back and had any significant side effects. You'll read up in there that there can be. One of the biggest side effects is daytime sleepiness. So that's if you're not taking it correctly. And even if you are taking it correctly, sometimes it still lasts that long that you feel sleepy during the daytime. And then obviously you have to either adjust the dose or move it earlier on in the day when you're taking it, in the evening when you're taking it. But it works well for the people that it works well for.
And it doesn't have too much side effects for the melatonin.
No, that's what I was saying. I literally haven't had anybody who's come back with any side effects of
Okay.
melatonin, and I've used it a lot.
Okay.
And nobody's. I mean, the only one is that it makes you daytime drowsiness if you are taking it too late in the night, and the second one is that its effectiveness starts wearing off the more you use it.
Okay.
So, you have to just be careful of both those two things.
Thank you.
Okay. All right. So if we don't have any other questions, we have a good half an hour for
just one question, Naina.
Yes.
So like if I go to bed early between 9 and 10,
yes,
I wake up 2 to 3 times at least in night.
okay.
And if I go late, I might wake up once or even not.
Okay. If you go to bed later than 9.
Yeah. No, if I go early to bed between 9 and 10 o'clock.
Right. You wake up
then
2 or 3 times in the middle of the night. But if you go to
night, yeah.
bed later, then you wake up
Yeah,
less.
about after 11 o'clock, say. Then I
Then you
only
wake up one
sometime
time.
one time, yeah.
Okay. Okay. I mean, so sometimes if you're waking up, say, to use the bathroom or something, then that sometimes has to be managed by restricting fluids at night, because that will disrupt your sleep. And often in elderly and me as well, the waking up in the middle of the night to go to the bathroom is the biggest thing. But I'm able to go to sleep right away without a problem. But sometimes it's hard to fall back to sleep again, and that disrupts sleep. So then you want to restrict any liquids, say after like 6 p.m. You probably don't want to have any fluids. Then sometimes that reduces that. If that's not the case, then also it might be that you don't need as much sleep at night, that you like at 9 o'clock, 9, 10, 11, 12, 1, 2, 3, 4. That's 7 hours of sleep. Waking up at 4 a.m. is 7 hours of sleep. And as we get older, we do require less sleep. And as I was saying yesterday, that we also have much more just as a general sleep cycle, it's much more disruptive. So we're going through those cycles more often.
Okay.
And so that's making us awake as well. So for that, the treatment for that, I think, is that you delay your bedtime. So go to sleep a little bit later. I know if you're falling asleep at 9 o'clock, then it's hard, right? That you're trying to keep awake because you really don't want to go to sleep. Otherwise, somebody will say at 4 a.m., do a nice early morning meditation. Best time to do meditation, they would say.
That's correct. Yeah. I tried a couple of times, but
but then sometimes that's hard. It's all dark outside.
No, but then I start feeling sleepy in the daytime.
And then you feel sleepy in the daytime. Okay, so that's also important to make sure that you're not, if you're having a hard time sleeping at night, it's really important that you don't sleep in the daytime. Because many times as we get older, we want to have that afternoon nap after our meal, right? We're at home, not really doing anything. We can always fall asleep after lunch and have a nice 2-hour nap. That's going to affect the nighttime sleep a lot. So it's nice to have that nap, but it's only good if you're not having problems sleeping at night.
I hardly sleep in the daytime, apart from if I'm relaxed, then I feel asleep. But otherwise, most of the time I've been working around.
Okay, but you just feel tired in the daytime?
No. If I'm working around, I don't feel tired. But if I'm sitting
I
more,
misunderstood you. I thought you were feeling tired in the daytime if you're not sleeping at night.
No. If I wake up early, 4 o'clock, to do some praise or anything, meditation or anything, then I feel more sleepy in daytime. I tried to do meditation after waking up at 4 o'clock, but then I start feeling more sleepy in daytime after 6 o'clock.
Yes, then you start feeling sleepy after that. Okay. Yeah, it's really hard to know how to manage sleep as we get older, in the sense of how much sleep do we need, but more importantly, how can we have good sleep so that we feel refreshed afterwards when we're in the morning. I think if it's 4 o'clock, say 4 to 5, you meditate, then at 5 o'clock you go back to sleep again if you're feeling sleepy, and then wake up at 8 or 9. Maybe that might help. I don't know. Somebody might have some good advice in that. I think medications or anything like that would not be helpful, because it's a different kind of sleep cycle that you're in, which isn't going to work for that.
What is the problem?
Thank you.
It's early morning awakening, Samniji. And then when you do meditation, it makes him more sleepy in the day. 4 o'clock meditation is making him more sleepy in the daytime.
Early in the morning, if he is doing meditation, then he is having that problem.
He's having so he's waking up early. He goes to sleep and he's waking up at 4 o'clock. So I was saying maybe doing a 4 o'clock meditation is a good time for meditation. So he's tried to do that meditation at 4 o'clock, but then he will be sleepy at 5 and 6 and 7 for the morning. It doesn't make him awake afterwards.
Okay, so it is not necessary for him to wake up in the morning, early in the morning, till he thinks that he needs the sleep. Then he should be fresh first, refreshed, and then he should sit in the meditation. So 4 o'clock is not suitable for him. So he can wake up when he gets up.
So Narendra Bhai, you're waking up at 4, right? Even if you don't want to wake up at 4, you're waking up at 4, correct?
I try to do it meditation, as Samniji told. It's better to do like meditation things at 4 o'clock.
Yes.
Sort of time between 4 and 5.
Yes.
And I try to do that activity to do meditation, but then I was feeling more sleep in the daytime after 6, 7 o'clock.
Yeah, so he need not to do meditation at that time, because he has already got some heart surgery and like this. Okay, so his health doesn't permit to do meditation.
Okay.
Is it? So you can, when you are free, you feel fresh, and you have taken you have not taken either breakfast or after 1.5 hours of breakfast, when you feel comfortable, then you have to sit in meditation.
Okay, ma'am. Samiji.
Yes.
Thank you,
Okay,
Samiji.
Yes, that is for the healthy people. Okay. But
Thank you,
not for
Samiji.
all. Yes.
Okay, yes.
Yes.
All right. Thank you, Samiji. I think if there's no more questions, then I'll hand it to you.
Well explained. Thanks.
Yes. Okay. So thank you very much for the wonderful talk on the treatment of sleep disorder. And you have rightly said that before sleeping, we have to shut down all our electronic medias, because the screen light also disturbs our sleep.
Mm-hmm.
And our brain doesn't sleep easily after just closing what is shutting down all the electronic means just 1 or 2 minutes before. But at least a half an hour or at least 1 hour before, if we can shut down all those electronic things and can go to our bed, we can meditate, we can do relaxation or body perception, but we need not to see the mobiles or electronic things in the last moment, up to the last moment of the sleep. So that is a really very good thing. And yes, but whatever other people have some problems of sleep orders, you have suggested all good treatments, so people can follow that. So thank you very much for the talk.
Wandami, Samiji.
Yes. Now who would give the session?
No.
Sheetal is ready, or Dineshji, Shivani, or anybody else? Anita? Yeah.
Yes,
It is
I
not
can give, but
necessary that
I'll
all the instructions should be in your mind. Just you can start with the textbook, looking at the text, and I want to see that whether you are able to give instructions after a proper interval, so that the participant should feel what you are suggesting or instructing. Is it? So how you are giving effectively the instructions. So you can keep on the textbook open before giving instructions. So anybody can do that, and it is easy for everybody.
okay. I can give,
Yes.
I'll refer the book in between because I did not prepare, but I can
Mhm.
take a tab.
Yes.
Nice.
So
All right.
Anita, yes, you are giving, is it?
Yes.
Okay.
Vandami Namaskar, Samiji.
Mm.
So, if you want to stretch, we'll do a quick stretch and then we'll sit in for the meditation. So, Tadasana, stretch your hands up, interlocking. Breathe in on your tippy toes. Breathe out, back to Tadasana. Couple more times. Now we'll sit in a comfortable position, Padmasana or any cross-legged position that's comfortable for you. Hands in Gyan Mudra. And we'll slowly close our eyes. And we'll start our practice with 3 Mahaprandhvani. So we'll take a deep breath, and while breathing out, we'll make the humming bee sound from the center of our nostril and concentrate on the center of knowledge. Now, the resolution for meditation. I'm practicing meditation. I'm practicing Preksha meditation for the purification of my psychic. I'm practicing Preksha meditation for the purification of my psychic. I'm practicing Preksha meditation for the purification of my psychic. We'll start with the first step, Kayutsarg. We'll concentrate our mind on the big toe of our right leg and give auto-suggestion to relax each tissue, cell, each and every part of our right big toe is relaxing. The big toe of our right leg is completely relaxed. And we'll slowly move our attention to the remaining toes of our right leg and relax each one by one. Then slowly move to our sole, ankle, calf muscles, knee, thigh, all the way up to the hip joint. And relax each and every muscle of our right leg. Our right leg is completely relaxed. And focusing our attention to our left leg. In a similar fashion, we'll start from the big toe of our left leg. Rest of the finger toes. And relax the sole, ankle, calf muscles, knee, thigh, up to the hip joint. And give auto-suggestion to relax each and every tissue and muscle and cell of our left leg. Our left leg is relaxing. And our left leg is completely relaxed. Moving to the mid portion of our body. The lower abdomen. Upper abdomen. Navel area. Large intestines. Small intestine. Kidneys. Spleen. pancreas, liver, diaphragm, relaxing each and every organ, the rib cage, chest, heart, lungs, all the way up to the collarbone. Each and every part is relaxing. Back portion of our mid body, entire spinal cord, all the organs are relaxing. Focusing on our right hand, thumb, fingers, palm, wrist, lower arm, elbow, upper arm, up to the shoulder. Entire right hand is relaxing. And right hand is completely relaxed. Focusing on the left hand, thumb, fingers, palm, wrist, lower arm, elbow, upper arm, all the way up to the shoulder. The left hand is relaxing. And the left hand is completely relaxed. Focusing on our neck, throat, relaxing our vocal cord, the vocal cord is relaxing. Throat, neck, and vocal cord are completely relaxed. Focusing on our head, our chin, cheeks, ears, lips, jaws, nose, tongue, eyes, forehead, brain, all the parts of our head are relaxing. And our head is completely relaxed. Entire body is completely relaxed. Now we'll move to the next phase of our meditation today. Perception of body, Sarir Praksha. We'll concentrate on each and every part of our body one by one and perceive the sensations and vibrations taking place in each part. We'll concentrate our mind on the big toe of right foot, and allow it to spread and permeate throughout the whole portion of the toe. We'll perceive all the sensations and all the vibrations occurring on our big toe. Just perceive them, become aware of them, without any liking or disliking. Use deep focus and be fully alert. Now we'll shift our attention to each and every part of our right limb, the other toes, concentrate our mind and perceive it. The sole, the heel, upper part of the foot, calf muscles, the knee, thigh, up to the hip joint, perceive the whole leg, the entire right limb, and experience the sensation and vibrations taking place in each part. If there is any pain, any tingling, just perceive it without any judgment, with equanimity. In the same way, we practice perception of all the parts of our left limb, our left big toe, the remaining toes of the left leg, the sole, the heel, ankle, calf muscles, knee, thighs, up to the hip joint. Experience the sensations and vibrations taking place in each part of your left leg. Feel the vibrations. Now we'll move to the middle part of our body, from waist to neck. Concentrate your mind on each part one by one. Perceive the waist area, navel, abdomen, big intestine, small intestine, kidney, spleen, liver, pancreas, stomach, and the diaphragm, and the whole portion of your chest, including the lungs, the heart, the ribs, the throat, and the vocal cords. Perceive, feel all the vibrations taking place in the middle portion of your body, and continue to maintain equanimity. Now we'll perceive the whole portion of the back, including the spine, spinal cord, and the neck. Perceive each and every part of your back, and feel the vibrations, the sensations taking place in the back side of your body. Now we'll concentrate on the entire right hand and arm, including thumb, fingers, palm, wrist, lower arm, elbow, upper arm, and the shoulder. Perceive each part one by one. Feel all the vibrations. Experience them without any like and dislike. Now, in the same way, we'll concentrate on the left hand and arm, thumb, fingers, palm, wrist, the lower arm, elbow, upper arm, and the shoulder. Use your deep concentration and remain fully alert and feel the vibrations taking place in your left arm, Now we'll move to the upper part of our body, from chin to head. The chin, lips, inner portion of our mouth, including tongue, teeth, palate, the cheeks, nose, the nostrils, the outer portion of the nose, the right ear, all the three parts, the outer, middle, and the inner, the temple, left ear, inner part, middle part, outer part, the right eye, the left eye, the forehead, and the head. Perceive each part one by one. During this perception, feel all the vibrations taking place. Now perceive all parts of your brain, the front, the back, the right, the left, the outer, and the inner. And allow your mind to permeate throughout the brain. So you have completed a trip from your toes all the way up to your brain. Now we'll practice perception of body as a whole. You may stand up slowly and carefully, keeping your eyes closed. And allow your mind to travel from the big toes to the head, and from the head to the big toes, rather speedily, passing through each part of the body. Perceive the vibrations throughout the body. Experience a tingling sensation in each and every muscle, skin, nerve, and cell produced by the contact of your conscious mind. Get yourself completely absorbed in the perception of body. Give it a few breaths. And now allow your mind to travel throughout the body rather slowly. If you experience any pain or any peculiar sensation, you may stop there for a while and perceive it with equanimity, without any judgment, without any liking or disliking. Now we'll slowly come back to the seated position. Take 2 to 3 deep breaths. With Om. 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 Rub our palms and put it on our eyes. And slowly open our eyes and conclude the meditation. Nami Namaste. Jai
All
Jinendra.
have enjoyed. Thank you. Because you were not informed before. Instead of that, you have given session. So thank you very much.
Amazing. Thank you so much.
Yeah.
Thank you,
Yeah.
Jai Jinendra.
So how was the meditation to all the people?
Excellent, Samlij.
Excellent. Okay.
Good.
It was actually really good, Anita.
Yes.
I
Thank you so much.
felt actually very relaxed and felt that I was actually perceiving. I felt this time with actually some cold feeling in my body. So I'm assuming that's my sensation, and it was I actually was perceiving it, which was actually really good.
Good to know. Thank you so much.
You did it very well, very calm and very slowly and very well.
Thank you.
Thank you. Next, who is ready to give the session?
Samlij, I can do
Dinesh is
tomorrow.
ready?
Yeah, tomorrow I'll do.
Okay. So yeah, the book, you can keep the book open so that you can see all the instructions in a proper way. But just your way should be like that you are giving session to others and you are meditating by in yourself also. So
Sure,
instructions
Swamiji.
should be very effective, just so that other people can go into deeper meditation.
Sure, Swamiji.
Okay. So thank you. Thank you, everybody.
Nami
Thank you,
namaste.
Swamiji.
Namaste,
Namaste,
Swamiji.
Swamiji.
Yeah.